Hi, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1 Million Minute. This is kind of a recap of the day. This is a Tuesday in the clinic. There were 19 patients. This was a kind of a rescheduled day because I'm going to be going to a conference, so I was going to take today off, but I had to move patients to this day. So it's a little bit of a mix mash of kind of a routine day. And about like the second half of the day was the routine, and the first half was just kind of normal. So let me go over a couple of things. First, I want to start with my most valuable patient. This was a gentleman, 48-year-old man that's been dealing over a year with some fifth metatarsal kind of pain. He was concerned he had a fracture, and it wasn't a fracture, but he did have a lot of like thickening around the capsule. On the ultrasound, X-ray did not show any break, and he wanted kind of treatment for this. So since it's been going on for so long, it's actually making him limp. He can't even walk on it. What we decided to do for this kind of capsulitis / metatarsalgia issue is we did an X-ray today, ultrasound, level 3 visit, and then he's going to get 6 sessions of shockwave or EPAT, and at the second one we're going to do an amniotic injection. And we're going to do that kind of in the area of the effusion that we saw on the ultrasound today. So that's like an MVP patient. He's going to be getting combo shockwave, which is radial and focus. So if I could have these all day long, I would. This was actually a self-pay patient as well. So next was a surgical consult, which is always a level 4 for me. And in my EMR, I have a way of doing I sign the consents 30 days before, right, before I do the surgery, and then I give them the prescriptions. So I do Percocet, Vistaril, and Motrin, but I send it over a couple of days before, and I can do that with my EMR where my scribe sends it, and it doesn't show up till like a couple of days before surgery. And they also got a shower cover. All of them get shower covers. Another patient was a patient that he had an exostosis on the medial fifth toe. Once again, that was an X-ray, and he wanted to wait for the holidays to come by. So in 2 months, we're going to plan on doing an exostectomy to that toe. Basically, just a little stab incision, a little rasp down the inside of that toe. It makes him feel a lot better, and I just trimmed the callus for him. Another patient that had a painful hammer toe, and we got X-rays for him. And then there was also a couple of routine patients, and a patient that was getting Lunula, and when she started Lunula, she really wanted Lunula, right? And so we did that. What we usually do for Lunula is we do 4 sessions once a week, and then 6 weeks after I do a 5th, and 6 weeks after a 6th, and then like 6 weeks after they see me. So it's a number of visits. I usually talk them mostly out of it than into it. But this patient, initially when she came in, her nails were so short, I wasn't able to take a nail sample, and so I did a nail sample today. So it was a level 3 visit because of the nail sample discussion, and then she's going to continue the Lunula. Then the rest of the day was really a couple of kids for Ingrown toenails where I did INDs. Now, just a reminder for INDs, I tend not to see them back because they usually heal uneventfully. If I would do a matrixectomy, I would tend to see them back in about 3 weeks, just one time. And then a couple of other patients that had some things going on with the routine. One was she had kind of cramping and arthritic pain in the sinus tarsi, so I was able to do a level 3 visit for her. And I talked to her about cortisone. She didn't want it today. She had done it in the past. And then finally, there was another patient that came in for routine, but he had a little verrucous lesion on the first med head. And so I did the routine, did the lesion destruction with silinocaine, and he'll come back in 3 weeks for cantharidin and also the routine care. So that was a kind of a way of getting something else out of a routine day, and I'll be seeing him for that. We'll start with the cantharidin. There's a real small lesion, otherwise I would have kind of offered Swift for him. A couple of other things I just want to talk a little bit about was we talked about exostectomy, pre-surgical discussion. Then a couple of things I'm working on right now. I'm working on a calculator, and so this calculator is something that as a lot of doctors have been asking about, like, how do you determine like if it's a good deal to do like shockwave or to do ultrasound or to do Swift or get an associate or start using a scribe. So I have this like calculator. Basically, it's an Excel spreadsheet that I can share, and in there you can put in the numbers, and it'll like spit out the answers. So I did the best I could. It's kind of in a trial version right now. If you want to see it, you can email me, don@podiatrypracticemastery.com. I say, Don, hey, send me that Excel calculator, and I will send it to you. Currently, it's also, if you have access to all of my treatment sheets, it's in that same folder where my treatment sheets are. So if you want to get my treatment sheets, you can just go to podiatrypracticemastery.com/EMR. I think in the EMR one they would have the treatment sheets, or you can just email me. I'll get those to you. Okay. I think you'll like the calculator. It's something I'm kind of working out. It should get better over time. And once again, I hope you found this beneficial. If you want to learn more, go to Podiatry Practice Mastery. If you have any questions, let me know.